Still dealing with going to the bathroom. Like, it's a whole life change. Like, I can't, and I'm gonna be transparent, I can't pee like I used to pee. It's totally different. I depend on depend.
Taking it in stride. That is the raw reality from NFL legend Deion Sanders, who recently shared that he had his bladder removed after a cancer diagnosis. Sanders says he is now cancer-free, but his story is shedding light on a disease that affects tens of thousands of Americans every year. So joining me now is Dr. Rohan Sharma, an oncologist with Honor Health Cancer Care. Thanks so much for being here. You know, a lot of times we don't hear about bladder cancer. It's almost a little taboo in a way. So explain exactly what is it?
So thanks for having me. You know, I was taken aback by the news about Deion Sanders as a 90s kid who watched him primetime and everything. But it is more common than we think, you know, unfortunately. There are certain risk factors associated with it. Smoking, there's a very strong male predominance, about 3 to 4 times more likely in men.
Yeah, and I saw that men are 4 times more likely to have it than women. Why is that?
So I don't think it's entirely clear, you know, to be honest. You know, I can't give you a great answer on that, but, you know, we do see that male predominance, also more common in African-American males in particular. And you're absolutely right, when it presents, it tends to be more aggressive in those folks.
Are there certain causes? I mean, is it diet? What could cause that?
Sure, so I would say smoking far and away is the most common risk factor, but I'm sure Deion takes care of himself, so sometimes it's just bad luck. You know, there's certain dyes that make it more common, nitrated foods, environmental factors, but sometimes it's just bad luck.
Yeah. So let's go over the signs and symptoms.
So the most common presenting symptom is usually just blood in the urine. So obviously, if a man sees that, he's going to present to his doctor or his urologist. Pelvic pains can occur, unintentional weight loss. You know, these are sometimes cardinal symptoms, but sometimes people don't have too many side effects, and it takes a very strong index of suspicion to present to a doctor. You know, if someone's blood count is a little bit too low, or, you know, just kind of nondescript pains.
Is it one of those things where, you know, it's hard to detect until maybe perhaps you're being looked at by a doctor for something else, and then, you know, that something else leads to that tragic diagnosis?
Yeah, so unfortunately, compared to other cancers like breast cancer, colon cancer, as far as I know, there's not really a screening test, you know, so a lot of it is based on the symptoms, you know, when would cause someone to present to a physician.
Right. So what is surgery and recovery like? I mean, I was reading that you can actually get a new bladder through the small intestine?
Yeah, so I should preface this discussion by saying I'm not a surgeon. I left the scalpels behind a long time ago. I'm a medical oncologist, so I deal with the systemic treatment of bladder cancer, whether that's chemotherapy or immunotherapy. But I can say that our surgeons do get rather creative. It's a lot more refined than it used to be. And certainly, yes, people can use parts of the bowel to construct a neobladder. That's certainly possible. That still, you know, means that someone will have quality of life changes. But, you know, it's an exciting time, you know, for bladder cancer patients.
Yeah, that really is amazing. All right, thank you so much for your insight. We really appreciate it, Dr. Sharma.
Thanks for having me.